Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everybody, welcome to this episode. We're talking about vets and bodywork today, which is a good topic to talk about, and it's a topic that I have discussed with so many people. So we're going to have a bit more of an open discussion around it between myself and Sophie. So how are you going today, Soph?
Raquel, I'm going awesome. I'm looking forward to this conversation. It's just casual discussion talking about the concepts and all the different, well, many of the different perspectives that come up talking about this topic. How do you want to start it off?
Yeah, I think I'll just start off with a bit around my experience, because obviously I came into this as a vet. So I'm coming at it from a bit of a different perspective than, say, other body workers are coming at it. And that when I kind of started out with equine muscle release therapy, so it's a little bit more alternative than, say, acupuncture and chiropractic and that sort of and straight rehab, right? Like it's a little more, it's harder to explain, it's not as evidence-based. And for a long time, like I had a really big complex of imposter syndrome. You know, I'm like, is it doing anything? Am I changing things? Like, is this real? This doesn't fit with my veterinary knowledge. It doesn't fit with necessarily evidence-based medicine. And so if other vets kind of ask me, well, what can you help with? Or I would just kind of I'd like lose my words and then not be able to explain it to them and just feel like a complete idiot. And so in the end, you know, I just stopped trying to explain it and I just let my results do the talking. So, you know, I'd then kind of try to, if they were interested, only if they were interested, I'd share with them, you know, positive outcomes that I'd had. And I was working in a vet clinic at the time, so I was treating small animals specifically. And so if there was, you know, a case that, say, a spinal dog that couldn't walk, like, you know, I would try to explain to them what happened if they were interested or they referred. But I also was, you know, at the time, like, why don't the other vets refer to me? And what I realized was there was a few reasons. One was fear, because they didn't know what I was doing. They couldn't explain what I was doing. And they didn't want to let go of their client in an unknown way, if that makes sense. Like all the medications they prescribe, they know what effect that's going to have on the animal, generally how the animal's going to respond, what the outcome's going to be, and what the expectation is. But in referring to me, they had to kind of let go of the control of the outcome for that animal, and also let go of not knowing, you know, what was happening to the animal. So that was a big thing. And also there's that line of like, and this is why I stopped vetting, was because I felt like I was constantly having to treat things in a way that was expected of me as a vet, when I knew that there were other options for the animals that could actually make them better, as opposed to treating the symptoms. So, and then at that point, it became really challenging for me to then work as a normal vet, because You know, we need to look at this dog's lifestyle or this horse's lifestyle. We need to look at so many other things that are leading to this being a problem, than just treating the tendon injury or the, you know, the dog with the spinal problems who was like really overweight and things like that. So I just saw that there's so much more to this. So that was, yeah, kind of my challenge in shifting out of vet into bodywork.
Yeah. And, you know, would you say that as you've changed and over the last few years, what do you think has, you know, you've been practicing bodywork for over a decade now. What do you think has changed in those attitudes? You know, where have you seen a change in people as they, you know, as these things have become more mainstream and more evidence has been garnished, particularly in the human world? You know, way more studies are being done on the understanding of fascia, on better rehab systems, exercises. You know, how are you seeing that filter through now to the spaces you were just talking about?
I think I've seen it filter through a lot more in the small animal space before it has in the equine space. So, you know, like we were getting more rehab centers in the small animal space that had treadmills, that had kind of other, you know, like we're seeing in the small animal space that we actually have body workers and rehab professionals working in vet clinics now. And so there has been that shift in that space. And I think because dogs are part of the family a little bit more than horses, that's pushed that a little bit quicker. But if we look at kind of other countries, so if we look at the US and even the Netherlands, like I worked with a number of vets in the Netherlands, you know, they had body workers as part of their veterinary team. Like the vets were doing the chiro osteopathy and they were part of their veterinary team as well. And in the US, like they have rehab facilities attached to their vets, and that they still have the same struggles over there in terms of, you know, some vets don't believe in it or whatever, but they do have a lot more, like they're still a lot more progressive than what we are here. Although in probably the last 5 years, there has been an increase in equine rehab facilities in Australia. You know, we're getting better diagnostic tools as well. And we're getting better facilities where, you know, we can look at ways to help improve strength and injury recovery in horses. So, you know, I think it is shifting, but I also think owner pressure on vets is increasing. So they're asking for more, and that's kind of pushing a little bit of change in the veterinary field.
Yeah. And I would even add there too, you know, people asking for more. All of these therapies, they are present. So, you know, enough people have developed therapies or they've brought them over from other places. You know, we have organizations, we have, there's a couple of groups within Australia, you know, that you can have a membership to. So there's quite a lot of, you know, on the topic of equines for us, there's quite a lot of equine body workers, you know, from osteopathy, chiropractic, Bowen, muscle release, massage, you know, and people who are just teaching, you know, on stretching and, you know, stretches and mobilizations, etc. Our online functional posture course, there's so much happening. It's impossible to deny it now as well.
Yeah, I think there has been, like, you know, when I started out in bodywork, so it was, yeah, like or when I graduated at EMRT, it was 12 years ago. And there was very small number still of body workers. You know, like in one area, you could still count the number of body workers who were servicing that area on one hand. Like I remember in Wagga there was hardly any at that point where I moved over to. And so, but in the last even 5, 6 years, 7 years maybe, like you said, the number of qualifications, insurable qualifications for bodywork, and the support of the associations that are trying to provide more of a more quality assurance has definitely increased, like massively. There's around Albury Wodonga now, there'd be probably at least 10 or more, like there'd be more than 10 people who service this area, like from a bodywork perspective, that are good body workers, like whereas previously, like you might have 10 but half of them had no qualification. So, and I think that's where also there was a bit of negative stuff happen around bodywork and vets, because there was a lot of what we call lay practitioners who didn't have a formal qualification, who didn't understand anatomy and biomechanics, who were going around adjusting horses and causing damage to horses. So like I knew of a few like fractured necks and things like that happened from an unqualified chiro. So I think that really didn't help in the progression of vets' perception of bodywork. So yeah, that's one area that's definitely changed in recent years.
So
Yeah.
if you, with the presence of bodywork and all kinds of therapies out in the community, how do you see bodywork complementing veterinary medicine now that you've seen both sides of the coin and you're.
I think the veterinary medicine's really important for the diagnosis. So, we want that diagnosis. It really helps in terms of the bodywork and rehab programs to be more specific. Understanding though that often there is more than one thing going on, and it is a whole horse issue generally, like unless it's a trauma-based injury. Even then, like leg stuck in the fence can often lead to a lot of upper body issues. I've seen many horses that years later were still had implications from that, even though at the time they had just dealt with a wound. So I think even in that sense, like a horse that has had a leg wound, a leg stuck in a fence, like checking the rest of the function of the body. One of the main areas is obviously neck and back pain. Like vets are pretty limited with what they can do with neck and back pain. So, they can inject with corticosteroids if they have access to shockwave, but even that, it's a complementary therapy. So you've still got to understand it to refer to it. So, and then in terms of improving horses, like say the horse has done a tendon injury, development of a rehab program, and also looking at that horse's whole body and figuring out, like, if the tendon injury happened relating to work, what's going on within that horse's body, how can we balance that body better? And also how do we kind of avoid and treat compensatory issues? So how can we support the horse? Say they've offloaded a limb, even from an abscess, right? Like they've offloaded a limb for an abscess, but they've had really bad abscess. So it's been maybe smoldering away for a few weeks, maybe even longer. They set up compensatory patterns in the body. Having those horses assessed with bodywork and treated with bodywork, like, can just make sure that they get back to full function and don't end up with some other injury that was unrelated to the abscess, but due to a loading pattern that developed in response to that. So I think can really help with that. And also pain control. Like they say, movement is so important for controlling pain. And so if you've got a horse with chronic pain issues, although I still don't think pain is necessarily well enough recognised by vets in horses, so that needs to improve. But helping, the horses find new movement patterns to help with pain and function, it's really important. And just overall, preventing injuries and improving well-being and longevity and comfort of horses so that they can live in the environment that we ask them to live in.
Absolutely. And there has been an adaptation through academic process as well. In the last 10 years in a university setting, I know as I was just coming through equine science, they were shifting from the 5 freedoms to the 5 domains, which is an understanding, the 5 freedoms was free from, hunger and thirst, free from injury and discomfort. And the 5 domains now, it encompasses 5 categories that look towards improving well-being and health rather than just, lacking evidence of a genuine disease or injury. So, it encompasses thinking about positive movement for well-being and health. So that coming through an institution is a great change, something positive that's happening there, thinking about like the length of a horse's life and their well-being and welfare throughout it, in front of and behind on a timeline, their injuries and how they got there as well. And of course, it's being discussed at a number of conferences and it's being talked about on social media. It came up at Equine as well, the fact that there is a shortage, in some areas of veterinary care for people who need it emergent or, are struggling to get into appointments because vets are limited with time. There's only so many places you can get to during the day, especially for vets who are mobile. They're on the road. I've worked for a couple of mobile vets. It's a lot of hours in the car that you're not actually working, but you have to incorporate into your day. There's a lot of things like that. Support systems, say what you're talking about with the support for rehabilitation, support for neck and back pain, that can be really useful. And what you were talking about, the concept, if you're not learning a baseline of the foundation of all of these complementary therapies, how do you know which ones to refer to for different issues once you have a diagnosis? And we don't have a huge amount of bodywork regulation. We have next to none in Australia. It's hard to define what could and couldn't be done by a body worker once you get into the technical regulation side of it. And there are people who I understand from the ABM qualification who have got tied up in legal issues because there's been grey area about veterinary procedures.
Well, it's not just in the ABM qualification, it's in every aspect
everywhere
of bodywork, so I think it's specifically understanding body workers' scope of practice as well as vets understanding their scope of practice, and understanding the veterinary regulations, because although body workers aren't regulated, there's still things that are considered veterinary procedures or acts, and it differs from every state, and so body workers need to be aware of that for their state. And I think that's important too when they're working in with vets, that they understand their position within the animal care framework, if you want to say, so that they're not stepping on vets' toes and not crossing the line with diagnosis specifically, and they know when to refer, because at the end of the day, you've got to earn the respect of the vet. Like, they've got to know that, yeah, you have the animal's best interest at heart, but you also know what you're talking about, and you're aware of your scope of practice, basically.
Absolutely. Yeah.
And that brings me back, because I really just want to talk about in terms of vet scope of practice. I've heard a lot of people bagging out vets because, you know, they didn't recommend this, or they didn't recommend that, or they missed this, or they missed that, or they don't believe in this, or they don't believe in that, or they boo-hooed Bodywork, or whatever it might be. And I ran a clinic last year for some vets, and, you know, I think the biggest thing was that they don't know about the bodywork modality, so they don't understand them. They're not taught anything about them. Generally, a lot of vet schools in Australia don't get anything on the different, or if they're very lucky, they might get one lecture out of, you know, 5-6 years. And that's if they go to that lecture, you know, because there's so much information, or if they remember. And so, you know, I think this is a big limitation for vets, is that they don't understand the bodywork modalities. They don't understand what they're doing. They don't understand the pros and cons of each different type of bodywork. They might not understand different therapeutic modalities, or they might have been taught some of those, but they don't remember because you're taught about every animal and everything else. They also don't have the same level of anatomy and biomechanics knowledge and awareness as some body workers will have better knowledge of anatomy and biomechanics because that's their sole learning, you know, like they're so passionate about it, like that's their drive, that's their, they've done heaps of dissections. Like at vet school, the dissections that I've done with Sharon May Davis, like I remember going to the first one and I stood there and the horse was beautifully presented on the table, and like she went through and dissected each individual muscle, and it took like 3 days, and we did one half side of the horse, and I was just like, whoa, okay, first of all, I thought I knew some anatomy, and first of all, I don't. Second of all, then she starts talking about variations in anatomy, and I'm like, no. Like the textbook said that this muscle attaches here and here, and that this bone should do this and look like this. And this is how it works because the textbook said. And when I went through uni, you know, now we learn a lot more out of papers and scientific evidence. But when I went through uni, you know, it was back before the internet was as big as what it is now. And we learned through textbooks, you know, so like what the textbook said at that point was taken as gospel a lot of the time to us. And so when I saw that, and then when Sharon also, I went to her biomechanics class and she's like, oh yeah, so I can see this and I can see that. And I'm like, what? And Ian Bistrup, he was the same. I'm like, no, you have to watch a horse trot. That's the only way you can see anything in the horse. They're like, no, you can watch a horse walk and we can see all of these things in the walk. And so I didn't learn that at vet school, either of those. I didn't have the depth of anatomy and biomechanical knowledge. I didn't have the depth of knowing different ways of exploring biomechanics. I had no lectures on rehab. Now this was 20 years ago now, but I had 0 lectures on rehab. I had 1 lecture on complementary medicine, which I was like, oh, this is awesome. And yeah, I couldn't have told you anything about rehab. I knew how to address symptoms and diagnose and treat them within my scope of practice. So, and I probably would not have referred to a body worker in that time because I would have thought, I don't know what they're going to do. Like, what if this animal, what if it's a bad outcome? It's on me. If I refer them, and this is what I had a discussion with the vets about at the weekend that I ran, was like, how do we know, you know, what they're doing? Like, how do we know it's good for our client? Because for the way we see it as vets is it's our responsibility. If we refer someone to someone, it's our responsibility that that's a good referral. So I think the way vets can get around it is they could say bodywork could be beneficial for this horse and not refer to anyone specifically until they've developed a rapport. And the way that body workers could develop that relationship with vets is that they try to talk to the vet about the cases. And I know some body workers have tried and not had positive experiences, but I also know others who have persisted through like really hardly persisted, and they've ended up developing relationships with the vets. And I've also had vets to me say, I don't know what you do, but I'm willing to refer to you because I've seen the outcomes. So we've just got to continue the conversation, and not develop not just jump to the conclusion that the vet doesn't want to support you, or that they don't want to support bodywork. Like, I think it's always important in any situation to see both sides of the perspective and to understand why people are sitting in those camps. And it's not always that they want to be difficult. It's just their fear or their unknown, or they feel their responsibilities, or they don't trust, they don't trust in the providers, whatever it is. And it wasn't until I was treating horses, well, I also had body workers treat my horses when I was growing up, that helped, but it wasn't until I was treating horses that I was like, oh my gosh, like, from a veterinary perspective, that should not have changed. Like, that should not have got better. And even now, I still get surprised many times. I'm like, holy crap, that changed. Like, I wouldn't have known what to do with that as a vet. I would have been at my limit.
Yep.
So, yeah.
So there's an incredible opportunity and a pairing for support from so many directions, bodywork side, veterinary side, and it can only, I suppose, go up from here. There's positive changes happening in lots of different places, and there's so many people who have made such a big effort, people who pioneered things, Sharon May Davis, people who began therapies and look for different ways of doing things for, the well-being of the horse that we have to be grateful for, and the veterinary community who do so much work and so much study and make such a huge positive impact in the life of so many animals who need them. When you need a vet, you really need your vet.
Yeah,
It's
and
a
I
big
think
deal.
it's important that if you can develop that relationship between your body worker and your vet, that would be amazing. And I think when you do approach it with your vet, it's thinking about how you approach it. And I think it's always good to ask questions rather than tell people, like, ask questions about would they be happy, you would, and it's not up to them, right? Like, it's not up to them whether you try body work with your horse or not. That's up to you. It's your horse. But you could explain to them, that you're considering trying body work. You have a really good body worker, you've seen these really great results. They have shown that they can help with these conditions. Would they like to be kept involved with that? Would they be open to chatting to the body worker about it? And trying to just open up the conversation. And if you get shut down, you get shut down, right? Like, you just have to be okay with that. It's not personal. But I've had people shut me down many, many times. And some of them I just learned, okay, like, that's okay, that's their stuff. But I just keep like chipping away a little bit. And maybe it's 2 years later, they come and tell me this great idea they had, or this great experience that they had, where, they I don't know, they tried acupuncture or something, like, whatever it is, sometimes you've planted a seed that might not have seemed to be taken up at all, but a few other people might have planted the seed as well, or a few other people might have talked about this local body worker, or there might have been a few other cases that came in where things have changed, and over time, like, people are converted. Like, I've had clients who are like, yeah, you're here because my horse is sore and I've exhausted my other options. I don't know if I really believe in this, but I have seen some results, so I'm willing to give you a try. And if they don't see results, I'm not going to be coming back, because those people really need results. So I think it's just being realistic, keeping the conversations open, working towards opening the conversations, and understanding both sides of the story and the perspective of the whole story.
Yeah, absolutely. Awesome discussion.
Yeah, and always, good to hear people's positive experiences between vets and body workers and how they've facilitated that relationship. Then that's always great to share as well. So awesome. Well, I think we'll leave it at that. So thank you for joining Dr. Raquel Butler, myself, and Sophie Vanderberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes. Find the links to our socials in the comments, and also links to the next upcoming Equine Functional Posture course.
See you in the next exciting episode.